our particular study used research samples from the BMTN 1507 clinical trial, which was a multicenter study looking at a reduced intensity haploidentical transplant regimen for sickle cell disease. And what we were particularly interested in looking at was to see if we could use a novel assay to evaluate engraftment in this cohort of patients. And we do have a way of monitoring chimerism or engraftment in patients clinically, but we were using this novel assay to see if it could tell us something different and new and potentially be used to complement existing clinical donor chimerism testing.
So yeah, in our lab, we did correlative studies. Apart from clinical studies going in parallel, we did chimerism based on molecular level. We used something called HFA assay, that is molecular-based assay where we're using HLA antigens to detect pre and post-transplant to see if the donor-based lymphocyte chimerism is there post-transplant in patient. And with this method, with the HFA assay that we did in our lab, it's a novel method. We optimized it and we translated it. We saw out of 33 patients, 31 engrafted, which also we saw that clinically. And in 2 patients, we saw that 1 secondary graft failure, which was confirmed to be secondary graft failure clinically, and 1 problematic engraftment where we saw depletion in T cells and NK cell chimerism, which also we saw that clinically as well. So our assay was on a molecular level deems to be a little bit more precise for early detection is what our conclusion was.
Yeah, so importantly, our assay correlated very well with the expected clinical results, but it potentially allows us to identify patients who may be evolving to have graft failure or at risk for graft failure earlier than conventional testing, which could allow for interventions to be done to save those patients so they don't have graft failure. Because we only had 2 patients in the entire cohort that had problematic engraftment, the study is a little bit limited, given that that low number, so it needs to be kind of further studied in larger populations. This was just the adult cohort. We also are looking at it in the pediatric stratum of the trial, which did unfortunately have a slightly higher rate of graft failure.